So the topic I chose to do my informative speech over is mental health, because I think it's something that we often neglect and most people don't take very seriously, because if you're physically ill, you would go to a doctor because most of the time it's hurting you and you can feel it hurting you. But mental health, most people don't really take care of it until it gets severe, because it's not something that's physically on your body. It can manifest itself, but mental health is something that most people neglect, or people think that they act a certain way to get attention, and that may not be the case. So mental health, it's the way that you respond to the environment around you, the choices that you make in your environment. It can be your mood, your behaviors. Things that play into your mental health are genetics, because some people are just genetically designed to have mental problems. Drugs and alcohol, that can alter your mental state. Trauma, most people who have experienced severe trauma and abuse tend to have mental problems, or a stressful environment, because being in a stressful environment can always take a toll on your mental health. Some mental disorder is whenever your behaviors change, and a mental disorder is when it causes you not to be able to live a normal life, not function normally. So a few of these would be depression, anxiety, bipolar disorder, schizophrenia. There's many, many more, but those are some that can cause you not to be able to live a normal life. And, the things that can cause mental disorders, like I just said, can be abuse, trauma, drugs, alcohol, genetics, all of those things, or some of those things combined. Most people who do have mental problems, it depends on the severity of it, but some people start exhibiting signs as children, or sometimes it doesn't come on until you're an adult. But some of the symptoms would be change in sleep patterns, change in appetite, substance abuse. If they weren't really a drinker before and they suddenly became a drinker or a drug user, that could be a sign. If you don't want to eat, or you eat all the time, that could be a sign. If you can't sleep, or if you don't want to get out of bed, that could also be a sign. Other symptoms in more rare cases would probably be homicidal behavior, where you want to hurt somebody else, or suicidal behavior, where you want to harm yourself. In order to know what is wrong with you, most of the time you need to go get evaluated by a psychiatrist, and they will tell you whether you are mentally ill or not, and they will tell you what's wrong with you. And then from that point on, they can send you to therapy or prescribe you medications. Some people, therapy tends to help, and then for some people that's just not enough. Sometimes they have to have medications, or medications could make it worse, vice versa. So of course, if it's an immediate problem, you should always call 911, and there's always the National Suicide Prevention Lifeline for people who feel like they may be suicidal. But I just think that it is good to be informed on mental health, because not very many people are. And you wouldn't neglect your physical health. If you broke your leg, you wouldn't just sit around with a broken leg. You would go to a doctor and get help. But many people who have mental problems don't see it the same way. And so, it can be something just as mild as having depression. Some people, they might get depressed, but it could escalate and get so severe to the point to where you might think of harming yourself or someone else. And most of the time, people let it escalate to that, or it could be something that's severe from the start, like schizophrenia, like a very severe schizophrenic. But either way, I just feel that it's very important for people to stay informed on mental health because, I mean, you can be physically feeling great, but if your mental health isn't up to par, then that's a problem because it's just as important to take care of your mental health as it is your physical health.